I thought 15 years operating on hearts had taught me everything. I was wrong. It was 11:43 at night when the ambulance screamed into our hospital in New York. The paramedic's voice cut through the chaos. 52-year-old male, massive heart attack, he's barely hanging on. But what happened in the next few hours wasn't about medicine. It was about something I never believed in. My name is Dr. Benjamin Rosenberg, and I've spent 15 years as a cardiovascular surgeon. 15 years trusting only what I could see, touch, and measure. Numbers on monitors, heartbeats per minute, blood pressure readings, cold, hard facts. That night, Vincent DeMarco was wheeled into my operating room, and everything I thought I knew about life and death was about to shatter. Vincent looked like any other father from Brooklyn. Wedding ring still on his finger, work clothes covered in paint. The kind of guy who probably coached his kids' soccer games on weekends. But right now, his heart was giving up, and fast. "Doctor, his wife and kids are in the waiting room," Nurse Bridget O'Connor whispered as we prepped for surgery. "They're praying, really loud." I barely listened. I was focused on Vincent's chest, on the monitors telling me his heart was struggling with every... This was going to be one of those nights where science would either save a life, but as we wheeled him into the operating room, something strange happened. Through the thick walls, I could hear voices. Not just talking, praying. It was Isabella, his wife, and their 2 kids, Francesca and Dominic. Their voices carried through the hospital corridors like a steady drumbeat. "God, please don't take him from us. He's a good man. He doesn't deserve this. Bring our dad back." I've heard families pray before. Usually it's quiet, desperate whispers. But this was different. This was loud, confident, like they knew something I didn't. Like they had some kind of inside information about how this night was going to end. Dr. Sean Sullivan, my anesthetist, caught my eye. "Never heard a family pray like that," he said, adjusting his mask. "They sound certain." I shrugged it off. 15 years had taught me that hope and reality don't always match up. Families pray, doctors operate, and sometimes people make it. Sometimes they don't. That's the brutal truth of what I do. But Vincent's case was bad, really bad. As I opened his chest, I could see the damage. His main artery was almost completely blocked. Blood wasn't flowing the way it should. His heart was working overtime, getting weaker with every beat. "His pressure's dropping," Nurse Esperanza Rodriguez called out, her voice tight with concern. The monitors started beeping faster. Warning sounds that every surgeon dreads. Vincent's body was shutting down, piece by piece. His heart was tired. It had been fighting for hours before he even got to us, and now it was losing the battle. "Come on, Vincent," I whispered, working as fast as I could. "Your family's counting on you." And that's when I heard it again. Through the walls, through the sound of machines and medical equipment, I could hear Isabella's voice. "He will come back to us. I know he will. Not, I hope. Not, please let him." She said, "I know." What kind of certainty was that? What did she know that I didn't? I've seen thousands of cases. I've watched families fall apart when hope turned into heartbreak. I've delivered news that destroyed people, and I've learned to keep my emotions locked away. Because in this job, feelings can make your hands shake when they need to be steady. But something about the DeMarco family was getting under my skin. Their prayers weren't desperate begging. They were like conversations with someone they trusted completely. "His heart rate's getting irregular," Dr. Sullivan reported, his voice cutting through my thoughts. I looked at Vincent's face. Even unconscious, even fighting for his life, he looked peaceful. Like he knew something too. Like he could hear his family's voices and was holding on because they told him to. "Daddy, we need you." I heard Francesca's young voice echo from the waiting room. "Please don't leave us." My hands kept working, but my mind was somewhere else. In 15 years, I'd never let a family's prayers distract me during surgery. Prayer was their thing. Surgery was mine. We stayed in our lanes, but tonight felt different. Tonight, the prayers felt like they were part of the operation. Like Isabella and her kids were working alongside me, pulling Vincent back from wherever he was drifting. "Doctor," Nurse O'Connor said quietly, "his oxygen levels are..." She didn't finish the sentence. She didn't have to. The monitors were telling us everything we needed to know. Vincent DeMarco was slipping away, and all our medical training was starting to feel pretty small compared to what was happening to him. Outside our operating room, the prayers got louder. Inside, the monitors got quieter, and I realized I was about to witness something that would change everything I believed about what keeps a heart beating. Vincent's heart was barely holding on, and time was running out fast. "Doctor, we're losing him!" Nurse O'Connor's voice cut through the tension in the operating room. The monitors were screaming warnings at us. His blood pressure was dropping, his pulse was getting weaker, and every second felt like we were watching him slip further away. But in the waiting room, something incredible was happening. Isabella DeMarco wasn't just sitting there crying like most families do. She was pacing back and forth, holding her kids' hands, and praying like she was having a direct conversation with God himself. "Lord, you know Vincent is needed here." Her voice carried through the hospital halls. "His children need their father. I need my husband. He's not finished yet." Francesca, their 16-year-old daughter, was holding her little brother Dominic's hand so tight her knuckles were white. But she wasn't scared. She was angry. "Dad's not going anywhere," she said, her voice shaking but determined. "He promised to walk me down the aisle someday. He promised to teach Dominic how to drive. He keeps his promises." 14-year-old Dominic was trying to be the man of the family, but tears were streaming down his face. "Mom, is he really going to be okay?" Isabella knelt down and looked both her kids in the eyes. "Your father is the strongest man I know, and God isn't done with him yet. We're going to keep praying, and he's going to come back to us." The confidence in her voice was something I'd never heard before. Most families hope. The DeMarcos knew. Back in the operating room, Vincent's condition was getting worse by the minute. "His main artery is completely blocked," I explained to my team, working as fast as I could. "The blood isn't flowing to his heart muscle. We need to clear this blockage now, or—" I didn't finish the sentence. Everyone in that room knew what "or" meant. Dr. Sullivan was monitoring Vincent's vital signs, and his face was grim. "Benjamin, his heart rhythm is getting really unstable. I don't know how much longer we can keep him under." Nurse Rodriguez was handling the surgical instruments, but I could see the worry in her eyes. She'd been doing this job for 20 years, and she knew when a case was slipping away from us. "Doctor," she whispered, "maybe we should prepare the family for—" "No," I said firmly. "We're not giving up on him yet." But honestly, I was starting to wonder if medical science was going to be enough. That's when I heard Isabella's voice again, louder this time, like she was talking directly to Vincent through the walls. "Vincent DeMarco, you listen to me. Your family is here and we're not going anywhere. You fight. You hear me? You fight." Something about the way she said it made me pause. It wasn't begging. It wasn't desperate pleading. It was like a command, like she had authority over life and death that I didn't understand. "Daddy, remember when you taught me to ride my bike?" Francesca's voice joined her mother's. "You ran beside me for blocks, even when your back was hurting. You never gave up on me. Don't give up now." Dominic's young voice cracked as he spoke. "Dad, you said real men protect their families. We need you to protect us. Come back." I've been in operating rooms during family crises before. Usually the waiting room is quiet except for soft crying and whispered conversations. But the DeMarco family was different. They were loud, they were confident, and they were fighting for Vincent's life just as hard as we were. "His pressure's stabilizing a little," Dr. Sullivan called out, surprise in his voice. I looked at the monitors. It was true. Vincent's blood pressure had stopped dropping. It wasn't good yet, but it wasn't getting worse. "Keep working," I told my team. But part of me was wondering if something else was happening here. Something beyond what my medical training could explain. As I continued the surgery, trying to clear the blockage in Vincent's artery, I found myself listening to the family's prayers. Not because I believed in them, but because their certainty was so strong it was almost contagious. Isabella was telling stories now, talking to Vincent like he could hear every word. "Remember our first date, Vincent? You were so nervous you spilled coffee all over your shirt. But you made me laugh so hard I knew I was going to marry you. And remember when Francesca was born?" she continued. "You cried more than I did. You held her so carefully, like she was made of glass. You said you'd protect her forever. When Dominic came along, you said our family was complete. You said you had everything you needed to be happy for the rest of your life. The stories kept coming, and with each memory, Vincent's vital signs seemed to get a little stronger. Not much, but enough for me to notice. Nurse O'Connor was noticing too. "Doctor, his heart rhythm is becoming more regular." "That's impossible," I muttered, but I couldn't argue with the monitors. "Nothing's impossible when God is involved." Isabella's voice rang out from the waiting room like she'd heard me. "Vincent, your family believes in miracles, and tonight, you're going to be one." I'd never heard a family speak with such absolute certainty about something that was completely out of their control. In my experience, families hoped, prayed, and waited. They didn't declare miracles like they were stating facts. But the DeMarcos weren't like any family I'd ever encountered. "Dad, remember the camping trip last summer?" Francesca called out. "You made us count stars until we fell asleep. You said every star was a reason to be grateful. Well, we're grateful for you, and we're not ready to say goodbye." "You taught me how to throw a curveball," Dominic added. "You said practice makes perfect, and you never give up on things that matter." "We matter, Dad. Fight for us." As I worked on Vincent's heart, something strange was happening. The blockage that had looked impossible to clear was starting to respond to treatment. The blood flow was improving, slowly but surely. "His oxygen levels are coming up," Nurse Rodriguez reported, disbelief in her voice. "I've seen medical turnarounds before. Sometimes patients surprise you. Sometimes the human body finds a way to fight back when everything looks hopeless. But this felt different. This felt like Vincent DeMarco was hearing every word his family said, and he was deciding to stick around. "Vincent?" Isabella's voice was softer now, but still filled with that unshakable confidence. "Our love is stronger than whatever is trying to take you from us. You come back to us. You hear me? You come back." And just as she finished speaking, something happened that made everyone in the operating room freeze. Vincent's heart rate suddenly jumped. Not in a dangerous way. In a strong, steady, fighting way. "What just happened?" Dr. Sullivan asked, staring at his monitors. I looked at Vincent's face. For the first time since he'd arrived, there was color in his cheeks. His breathing was getting stronger. The machines were telling us that Vincent DeMarco had just decided he wasn't ready to leave his family. But we weren't out of the woods yet. The most critical part of the surgery was still ahead of us, and I had no idea that what happened next would challenge everything I thought I knew about the line between science and faith. Because just when I thought Vincent was going to make it through, his heart was about to stop completely. And the only thing standing between him and silence would be the sound of his family refusing to let him go. Then it happened. The sound every surgeon fears most. The flat line. Vincent's heart stopped beating at exactly 2:17 in the morning, and suddenly the operating room went deadly quiet, except for that horrible, continuous beep that meant we were losing him. "He's in cardiac arrest," Dr. Sullivan announced, his voice tight with urgency. I looked at the monitors and my stomach dropped. No heartbeat, no pulse. Vincent DeMarco was technically gone. "Start compressions," I ordered Nurse O'Connor, but even as I said it, I knew we were running out of options fast. She placed her hands on Vincent's chest and began pushing, trying to manually pump his heart back to life. 1, 2, 3, 4. The compressions were keeping blood flowing to his brain, but barely. "Come on, Vincent," I whispered, working frantically to clear the remaining blockage in his artery. "Don't do this to your family." But here's the thing that still gives me chills when I think about it. At the exact moment Vincent's heart stopped in our operating room, something incredible happened in the waiting. Isabella DeMarco suddenly stood up, looked directly at the operating room doors, and said in the strongest voice I've ever heard, "No, you don't get to take him. Not today. Not ever." How did she know? How could she possibly know that at that exact moment, her husband's heart had stopped beating? Francesca looked at her mother with wide eyes. "Mom, what's wrong?" "Your father needs us right now," Isabella said, grabbing both her children's hands. "He's fighting the hardest battle of his life, and he needs to hear our voices." And then they did something that made every nurse in that hallway stop what they were doing and stare. They got louder. "Vincent DeMarco," Isabella called out, her voice echoing through the entire floor. "You have a family who loves you. You have a wife who needs you. You have children who aren't ready to say goodbye." Other patients' families were looking at them like they'd lost their minds. Hospital staff were probably wondering if they should ask them to quiet down. But the DeMarcos didn't care about hospital etiquette. They were fighting for Vincent's life. "Dad!" Francesca shouted, tears streaming down her face. "Remember your promises. Remember what you said about never giving up." Dominic's young voice cracked as he yelled, "We believe in you, Dad. We believe you're stronger than this." Back in the operating room, I was doing everything I could to restart Vincent's heart. We tried electric shock, we tried medications, we tried manual compressions, but nothing was working. "How long has he been down?" I asked. 3 minutes, Dr. Sullivan replied, watching the clock. 3 minutes without a heartbeat. In cardiac surgery, that's a lifetime. Brain damage starts happening. Organs begin shutting down. The window for bringing someone back gets smaller and smaller. But the prayers in the waiting room got bigger and bigger. "Vincent," Isabella's voice was so powerful it seemed to shake the walls. "I need you to fight. Our children need their father. I need my husband. You don't get to leave us." I've never heard anything like it. It wasn't begging. It wasn't pleading. It was demanding. Like Isabella DeMarco was having an argument with death itself, and she was winning. "Give him another shock," I told my team. We charged the defibrillator and sent another jolt of electricity through Vincent's chest. Nothing. "Daddy," Francesca's voice cut through everything. "Remember when I was little and I had nightmares? You'd sit by my bed all night to keep the monsters away. Well, I'm scared now and I need you to fight the monsters one more time." 4 minutes without a heartbeat. Nurse Rodriguez looked at me with those eyes that medical professionals get when they know it's time to stop trying. When they know that sometimes, despite everything we do, people don't make it. But I couldn't stop. Not with that family outside refusing to give up on him. "One more time," I said. "Charge it again." Doctor Sullivan said quietly. "Maybe we should—" "No," I said firmly. "Listen to that family. If they're not giving up, neither am I." And that's when Isabella did something that made my hands shake. She started talking to Vincent like he was standing right next to her. "Vincent, honey, do you remember our wedding day? You were so handsome in that suit. You looked at me like I was the only person in the world. You said, for better or worse, in sickness and in health. Well, this is the worst part, Vincent. This is the sickness part. But our love is stronger than this." Her voice was so clear, so certain, that for a moment I almost turned around to see if Vincent was actually in the waiting room with them. "You promised me 50 years together," she continued. "We've only had 19. You still owe me 31 more years, Vincent DeMarco, and I'm not letting you out of that promise." 5 minutes without a heartbeat. In medical school, they teach you when to call it. They teach you when to stop trying and when to accept that some battles can't be won. 5 minutes is usually that point. But something about Isabella's voice made me try one more time. "Clear," I called out, and we sent another shock through Vincent's body. Still nothing. "Come back to us!" Isabella suddenly screamed, her voice breaking with emotion for the first time. "Come back to us right now!" And then Dominic did something that made everyone in that hospital stop what they were doing. This 14-year-old boy, scared and crying and watching his father slip away, stood up in that waiting room and said in the strongest voice he could manage, "Dad, you taught me that DeMarcos don't quit. You said we fight for what matters most. Well, we matter most. So you fight." 6 minutes without a heartbeat. Nurse O'Connor was still doing compressions, but I could see the exhaustion in her arms. She'd been manually pumping Vincent's heart for 6 straight minutes. "I can take over," Nurse Rodriguez offered, but Bridget shook her head. "Not yet," she said through gritted teeth. "That family isn't giving up, so neither am I." And that's when I realized something that would change everything I believed about medicine. The DeMarco family wasn't just praying for a miracle. They were creating one. Their faith wasn't passive hoping. It was active fighting. They were literally willing Vincent back to life through pure, stubborn love. "Vincent," Isabella's voice rose above everything else. "If you can hear me, if any part of you is still fighting, then fight harder, because we're not leaving this hospital without you." 7 minutes without a heartbeat. I looked at Vincent's face, peaceful and still, and I made a decision that went against everything I'd learned in 15 years of medicine. "We're not stopping," I announced to my team. "As long as that family is fighting for him, we're fighting for him." Dr. Sullivan looked at me like I'd lost my mind, but he nodded. Nurse O'Connor kept pumping Vincent's chest, and in the waiting room, the DeMarco family kept praying like their lives depended on it. Because maybe, just maybe, Vincent's life did depend on it. But what happened next would test everything I thought I knew about the line between medical science and something much more powerful than anything they taught me in medical school. Because at 7 minutes and 32 seconds, when every medical textbook said it was too late, Vincent DeMarco was about to remind all of us that some things are stronger than death. 8 minutes without a heartbeat. In the medical world, that's an eternity. That's brain damage territory. That's when doctors start having the conversation about letting go. But the DeMarco family had a different conversation in mind. "Vincent DeMarco," Isabella said, and this time her voice was different. Calmer, like she was talking to someone who was listening. "I know you're tired, honey. I know you're fighting so hard right now, but I need you to hear something." She took a deep breath, and what she said next made every person in that hospital corridor stop moving. "Our love story isn't finished yet." Francesca and Dominic moved closer to their mother, and for the first time since this nightmare began, Isabella's voice got soft. Not weak. Soft. Like she was sharing a secret. "Do you remember what you told me on our first anniversary?" she whispered. But somehow her whisper carried through the walls better than her shouting had. "You said you didn't just love me. You said you chose me. Every single day, you chose me." In the operating room, I was preparing myself for the hardest part of my job. The part where I walk out to a waiting family and tell them that despite everything we tried, their loved one didn't make it. But I couldn't move. Something about Isabella's voice was holding me there. "Well, Vincent, I'm choosing you right now. I'm choosing to believe that wherever you are, you can hear me. I'm choosing to believe that our love is stronger than whatever is trying to take you away from us." Nurse O'Connor was exhausted from doing compressions for 8 straight minutes. But she kept going. Sweat was dripping down her face, her arms were shaking, but she didn't stop. "Doctor," she panted, "I can keep going. This family, they're not giving up, so neither am I." Dr. Sullivan was monitoring everything, and I could see the conflict in his eyes. Medical protocol said we should stop. But something else, something he couldn't put into words, was telling him to keep trying. "His brain activity," he said quietly, staring at his monitors. It's still there. Weak, but it's there. After 8 minutes without oxygen? That should have been impossible." "Daddy," Francesca's voice joined her mother's. "Remember what you always say about our family motto? DeMarco stick together, no matter what. Well, we're sticking with you right now. All of us. Me, Dominic, Mom. We're right here. And we're not going anywhere," Dominic added, his voice stronger now. "You taught us that when things get tough, that's when you find out what you're really made of. So show us what DeMarcos are made of, Dad." 9 minutes without a heartbeat. I looked at Vincent's peaceful face, and something strange happened. For just a second I could have sworn I saw the slightest movement. Not much. Maybe just my imagination. But something. "Did you see that?" I asked Nurse Rodriguez. She looked at Vincent carefully. "See what, doctor?" "I thought I saw—" I shook my head. Never mind. But Isabella wasn't done talking. "Vincent, do you remember the night Francesca was born? She was 3 weeks early, and we were so scared. You held my hand in that hospital room, and you said, 'God doesn't give us anything we can't handle.' Well, I'm holding your hand now, even if you can't feel it. And I'm telling you the same thing. God didn't bring us this far to leave us here." Something about the way she said it made my hands steady. I'd been shaking for the past few minutes, But suddenly, I felt calm. What if we tried something different? I said to my team. Dr. Sullivan looked at me. What do you mean? What if instead of trying to shock his heart back to life, we tried to support it while it finds its own way back? It wasn't standard protocol. It wasn't something they teach you in medical school. But something about this whole situation was making me think outside every textbook I'd ever read. Sometimes, I continued, the heart knows what it wants to do. Maybe Vincent's heart is listening to something we can't hear. Nurse O'Connor never stopped the compressions, but she looked at me with understanding. In 20 years of nursing, she'd seen enough cases to know that sometimes medicine isn't just about following rules. What do you need me to do? She asked. Keep doing what you're doing, I said, but gentler, like you're helping his heart remember how to beat, not forcing it to. As she adjusted her rhythm, Isabella's voice got stronger again. Vincent, remember our last conversation before you left for work this morning? You kissed me goodbye and I said, see you tonight. Well, it's tonight, honey. I'm here. The kids are here. We're waiting for you to come home. 10 minutes without a heartbeat. But something was changing in the operating room. The atmosphere felt different. Less desperate, more hopeful. Like we were all part of something bigger than just a medical procedure. His color is improving, Nurse Rodriguez noticed. How is that possible? She was right. Vincent's face didn't look as pale as it had a few minutes ago. There was a slight warmth in his cheeks, like blood was flowing better. Daddy, Francesca said, and I could hear tears in her voice. I need to tell you something. Remember how you always said I could tell you anything? Well, I'm scared. I'm scared of growing up without you. I'm scared of walking down the aisle someday without you there to give me away. I'm scared of having kids who will never meet their grandfather. Her voice broke, but she kept talking. But I'm not scared of tonight, because I know you're going to come back to us. You promised me you'd always protect me. And the only way you can do that is by staying alive. 11 minutes without a heartbeat. And then Dominic said something that made everyone in that hospital hold their breath. Dad, I lied about something. Remember last week when you asked me if I needed help with my math homework and I said no? I lied. I did need help. But I was trying to be tough like you. Well, I need help now, Dad. I need help being the man you taught me to be. But I can't do it without you. The honesty in that 14-year-old boy's voice was so raw, so real, that I felt tears behind my mask. You always said that real men take care of their families, Dominic continued. Well, your family needs you to take care of us by fighting your way back. Please, Dad. Please don't leave us. 12 minutes without a heartbeat. In medical terms, we were way past the point of no return. But the DeMarco family was operating under different rules. They were operating under love rules, faith rules, rules that don't exist in any medical textbook. Vincent? Isabella's voice was gentle now, like a lullaby. I need you to listen to my voice. Follow my voice back to us. We're here, honey. We're all here, and we're not leaving without you. And that's when it happened. At exactly 12 minutes and 17 seconds, something appeared on the heart monitor that made everyone in the operating room freeze. A blip. Just one. Barely noticeable. Did you see that? Dr. Sullivan whispered. I stared at the monitor. For a few seconds, nothing. Just the flat line we'd been looking at for 12 minutes. Then another blip. His heart, I breathed. It's trying to beat. Nurse O'Connor felt it too. Under her hands, Vincent's chest felt different. Less lifeless, more responsive. Keep talking, I called out toward the waiting room, even though they couldn't hear me. Whatever you're doing out there, keep doing it. Another blip on the monitor, stronger this time. Vincent, Isabella said, and it was like she knew exactly what was happening in our operating room. We love you. Come back to us. The blips were getting stronger. Not regular yet, but definitely there. Vincent DeMarco's heart was trying to remember how to beat. This is impossible, Dr. Sullivan muttered. But he couldn't argue with what we were all seeing. Nothing's impossible, I found myself saying, and I realized I was starting to sound like the DeMarco family. But we weren't out of the woods yet. The heart was trying, but it wasn't strong enough to sustain life on its own. Vincent was caught somewhere between being alive and being gone, and the next few minutes would determine which side won. "Daddy, please," Francesca whispered from the waiting room, like she somehow knew this was the crucial moment. "Please come home." And Vincent DeMarco's heart was about to give her an answer that would change all of our lives forever. Then it happened. At exactly 12 minutes and 43 seconds after his heart stopped, Vincent DeMarco's heart suddenly roared back to life. Not a weak flutter, not a struggling attempt. It came back strong, determined, like it had been waiting for permission to start beating again. Beep, beep, beep. The monitors exploded with sound after 12 minutes of deadly silence. "Oh my God," Dr. Sullivan whispered, staring at his screens in complete disbelief. "His heart rate is 68 beats per minute. That's completely normal." I looked at the monitors, and my hands started shaking. After 12 minutes without oxygen, Vincent's heart wasn't just beating. It was beating perfectly. "His blood pressure is coming up," Nurse Rodriguez called out, her voice filled with amazement. 120/80. That's better than normal for someone his age. Nurse O'Connor stopped doing compressions and stepped back, staring at Vincent's chest as it began rising and falling on its own. "In 20 years, she whispered, "I have never seen anything like this." But here's the part that still gives me chills. At the exact moment Vincent's heart started beating in our operating room, something incredible happened in the waiting room. Isabella DeMarco suddenly stopped talking mid-sentence. She was in the middle of telling Vincent about their honeymoon, and she just stopped. She tilted her head, like she was listening to something only she could hear. "Mom?" Francesca asked, confused. "What's wrong?" Isabella's eyes filled with tears, but she was smiling. "He's back," she whispered. "What do you mean?" Dominic asked. "Your father," Isabella said, her voice trembling with joy. "His heart just started beating again. He's coming back to us." Francesca and Dominic looked at their mother like she'd lost her mind. There was no way she could know that. No doctor had come out to tell them anything. There was no announcement over the hospital speakers. But Isabella knew. "How can you possibly know that, Mom?" Francesca asked. Isabella put her hands on her children's faces and smiled through her tears. "Because I felt it. Right here." She touched her chest. I felt his heart start beating again. Back in the operating room, Vincent's recovery was happening so fast it was almost scary. "His oxygen levels are perfect," Dr. Sullivan reported, shaking his head in disbelief. "His brain activity is completely normal. It's like he was never gone." "Doctor," Nurse Rodriguez said, pointing to Vincent's face, "look." Vincent's eyes were starting to flutter. After being unconscious for hours, after his heart stopping for 12 minutes, he was waking up. "Vincent?" I said softly, leaning over him. "Can you hear me?" His eyes opened slowly, and the first thing he did was try to speak. I could barely hear him, so I leaned closer. "Isabella?" he whispered. "My kids?" "They're here," I told him, my voice catching in my throat. "They're in the waiting room. They never stopped believing you'd come back." Vincent's eyes filled with tears. "I heard them," he said, his voice getting stronger. "I heard every word they said. I heard my wife telling me to come home. I heard my daughter asking me not to leave her. I heard my son asking for help." I stared at him. "You heard them? The whole time?" "I was somewhere else," Vincent said, trying to sit up slightly. "It was peaceful there. Quiet. But then I heard Isabella's voice telling me our love story wasn't finished, and I knew I had to come back." Dr. Sullivan was running every test he could think of, trying to make medical sense of what had just happened. "Vincent, do you know what day it is?" he asked. "Tuesday night," Vincent answered correctly. "I was painting the kitchen. I felt pain in my chest. Isabella called the ambulance. Do you remember anything after that?" Vincent was quiet for a moment. Then he looked directly at me. "I remember floating, like I was watching everything from above. I could see you working on me. I could see my family in the waiting room. I could hear every prayer they said." The hair on my arms stood up. There was no medical explanation for what Vincent was describing. I could see you getting frustrated, he continued, looking at my surgical team. I could see you all working so hard to save me. And I could see my wife refusing to give up on me. Nurse O'Connor wiped tears from her eyes. Vincent, your wife never stopped praying for you. Not for a single second. I know, he smiled weakly. I heard her. And that's what brought me back. Meanwhile, in the waiting room, something beautiful was happening. Isabella suddenly stood up and walked toward the operating room doors. She didn't knock. She didn't call for a doctor. She just stood there, her hands pressed against the doors, smiling. Mom, what are you doing? Francesca asked. I'm waiting for them to come tell us what we already know, Isabella said confidently. And what's that? That your father is going to be just fine. 2 minutes later, I walked out of those operating room doors to find Isabella standing there, waiting for me. Before I could say a word, she looked me in the eyes and said, He's okay, isn't he? I nodded, still in shock from what I'd just witnessed. Mrs. DeMarco, I need to tell you something. What happened in there? It wasn't just medicine that saved your husband. I know, she said simply. It was love. And faith. And the fact that God isn't done with Vincent DeMarco yet. Francesca and Dominic rushed to their mother's side. Dad's really okay? Francesca asked, tears streaming down her face. He's more than okay, I told her. He's awake, he's talking, and he's asking for all of you. Dominic, this tough 14-year-old who'd been trying to be the man of the family all night, finally broke down and cried. Can we see him? In a few minutes, I said. We need to get him stable and move to recovery. But I have to tell you something first. The DeMarco family looked at me expectantly. Your father was gone for 12 minutes. His heart completely stopped. In medical terms, he should have significant brain damage. He should be in a coma. He should have major organ failure. Isabella nodded, waiting for me to continue. But he has none of those things. His brain is perfect. His organs are functioning perfectly. His heart is stronger than it was before the attack. Doctor, Isabella said gently, are you trying to tell us this was a miracle? I looked at this family who had spent the entire night refusing to accept that death could take their husband and father. This family who had prayed with such certainty that it had shaken my scientific worldview to its core. Mrs. DeMarco, I've been a cardiac surgeon for 15 years. I've seen thousands of cases. I've seen some incredible recoveries and some heartbreaking losses. But what happened to your husband tonight? I paused, trying to find the right words. What happened tonight has no medical explanation. Your husband should not be alive. And he definitely should not be talking and asking for his family. But he is. Isabella smiled that confident smile she'd worn all night. Doctor, do you believe in miracles? I thought about everything I'd witnessed. The timing of Vincent's heart stopping exactly when Isabella seemed to know it. The way his condition improved every time his family spoke to him. The impossible recovery after 12 minutes without a heartbeat. Mrs. DeMarco, I said slowly, I believe in what I saw tonight. And what I saw tonight was your family's love literally bringing your husband back from the dead. Dominic looked up at me with wide eyes. So Dad really heard us? He really heard everything we said? According to your father, he heard every single word. Every prayer, every story, every plea for him to come back. He says that's what gave him the strength to fight his way back to you. The three of them hugged each other tightly, crying tears of joy and relief. Can I ask you something, Doctor? Isabella said. Of course. When you walked into that operating room tonight, did you believe my husband would make it? I thought about my answer carefully. Honestly, no. His condition was too severe. The blockage in his artery was too extensive. And after his heart stopped. But we did, Isabella said firmly. We believed he would make it from the moment we walked into this hospital. How? I asked. How could you be so certain about something that seemed so impossible? Isabella looked at her children, then back at me. Doctor, have you ever loved someone so much that giving up on them wasn't even an option? Have you ever loved someone so deeply that you'd fight heaven and earth to keep them with you? I thought about my own family, and I realized I was beginning to understand. That's what we did tonight, she continued. We didn't just pray for a miracle. We demanded one. We told God that Vincent DeMarco wasn't finished with his life yet, and we weren't taking no for an answer. Just then, Nurse Rodriguez came out of the operating room. "The DeMarco family?" she asked. "That's us," Isabella said. "Your husband is asking for you. He says he has some promises to keep." As the family walked toward the recovery room to reunite with Vincent, I stood there in the hallway, trying to process everything that had just happened. In 15 years of medicine, I thought I'd seen everything. But tonight, the DeMarco family had shown me something that would change the way I practiced medicine forever. They'd shown me that sometimes, love really is stronger than death. But the biggest surprise was still waiting for me in the recovery room, where Vincent DeMarco was about to tell me something that would make me question everything I thought I knew about the line between this world and whatever comes next. When I walked into Vincent's recovery room, I expected to see a typical post-surgery patient, weak, groggy, connected to machines. Instead, I found Vincent DeMarco sitting up in bed, holding his wife's hand, with his children on either side of him, all of them crying tears of pure joy. But it was what Vincent said next that made me realize this night was far from over. "Dr. Rosenberg," he said, his voice clear and strong, "I need to tell you something. About what I saw when I was gone." Isabella squeezed his hand tighter. "Vincent, honey, you should rest." "No," he said firmly. "The doctor needs to hear this. Everyone in this room needs to hear this." I pulled up a chair, genuinely curious about what this man who had just come back from 12 minutes of clinical death was going to tell me. "When my heart stopped," Vincent began, "I didn't just lose consciousness. I went somewhere else, somewhere peaceful, somewhere bright. And I wasn't alone." Francesca looked at her father with wide eyes. "What do you mean, Dad?" "I mean, I saw people there. People I recognized. My father, who passed away 10 years ago. My mother, who we lost when you kids were little. They were there, and they were happy. Complete." The room went completely quiet except for the steady beeping of Vincent's heart monitor. The same monitor that had been silent just an hour ago. "My father came up to me," Vincent continued, "and he said, 'Vincent, it's not your time yet. Your family needs you. Your work isn't finished.'" Dr. Sullivan, who had followed me into the recovery room, was listening intently. As a man of science, I could see him struggling with what he was hearing. "But here's the strangest part," Vincent said, looking directly at me. "My father told me something about you, doctor." "About me?" I asked, surprised. "He said you've been carrying a burden. Something about your own family. He said tonight wasn't just about saving me. It was about showing you something you needed to see." A chill ran down my spine. Vincent had no way of knowing about my personal life. No way of knowing that my own marriage had been struggling, that I'd been so focused on saving other people's families that I'd been neglecting my own. "What else did he say?" I asked quietly. "He said that sometimes God uses broken hearts to teach doctors about healing. And that your heart has been broken for a while now." I felt tears behind my eyes. Vincent was right. My wife and I had been having problems for months. I'd been working so many late nights, missing so many family dinners, that she'd started talking about separation. "Vincent," I said carefully, "how could you possibly know that?" "Because when you're between worlds like I was, you see things differently. You see what really matters. And what matters isn't the number of lives you save in the operating room. It's the life you live when you go home." Isabella was crying again, but these were different tears. These were tears of recognition, of understanding something profound. "Doctor," she said softly, "Vincent is right, isn't he? About your family?" I nodded, not trusting my voice to speak. "Then you need to go home to them," Vincent said firmly. "Tonight. Don't wait until tomorrow. Don't wait until next week. Go home tonight and tell them you love them." "But Vincent, I need to monitor your condition. I need to make sure." "Doctor," he interrupted, smiling, "look at those monitors. Look at my heart rate, my blood pressure, my oxygen levels. I'm not just stable. I'm better than I was before this whole thing started." He was right. Every single measurement was perfect. "Besides," Vincent continued, "I have the best medicine in the world right here. He gestured to his family gathered around his bed. I have love, and love heals everything. Dominic, who had been quiet during this whole conversation, finally spoke up. Dad, when you were gone, could you really hear everything we said? Every single word, son. I heard you tell me about needing help with your math homework. I heard you say you were trying to be tough like me. Vincent's voice got emotional. But you don't need to be tough like me, Dominic. You need to be honest like you were tonight. That honesty, that vulnerability, that's what real strength looks like. And Francesca, he said, turning to his daughter. I heard you say you were scared of growing up without me. Well, you don't have to be scared anymore. I'm not going anywhere. I'm going to walk you down that aisle someday, and I'm going to embarrass you at your wedding by crying like a baby. Francesca laughed through her tears. Promise? I promise. DeMarcos keep their promises, remember? Then Vincent looked at his wife, and the love in his eyes was so pure it almost hurt to witness. Isabella, I heard every story you told. About our first date, about our wedding day, about the night our children were born. But most importantly, I heard you say that our love story wasn't finished yet. It's not, she whispered. No, it's not. We have 31 more years to go, remember? You're not getting rid of me that easy. They kissed. And in that moment, I understood something about love that 15 years of medical school and surgical training had never taught me. Love isn't just an emotion. It's a force. It's something that can literally call people back from the dead. Dr. Rosenberg, Vincent said, turning back to me. I want to tell you one more thing my father said. What's that? He said that tonight, God used my family's faith to perform a miracle. But he also used you. He used your hands, your skill, your refusal to give up when medical protocol said you should. Vincent paused, looking at me seriously. He said you're exactly where you're supposed to be, doing exactly what you're supposed to do. But you need to remember that healing people isn't just about fixing their bodies. It's about believing in the power of love to overcome anything. Dr. Sullivan, who had been silent through this entire conversation, finally spoke up. Vincent, in 30 years of medicine, I have never witnessed anything like what happened tonight. That's because, Vincent said with a smile, most patients don't have a family like mine. Most patients don't have people willing to fight heaven and earth to bring them back. But some do, I said quietly, thinking about all the families I'd seen over the years who had refused to give up hope. Exactly, Vincent nodded. And those are the cases where miracles happen. When love meets faith meets skilled doctors who are willing to keep trying when everything looks hopeless. Nurse O'Connor, who had been standing quietly by the door, stepped forward. Vincent, I want you to know something. I've been doing cardiac surgery for 20 years. What your family did tonight, the way they prayed, the way they refused to accept that you were gone, it changed all of us. How so? Isabella asked. Because it reminded us why we got into medicine in the first place. Not just to follow protocols and monitor machines, but to be part of something bigger. To be part of healing. To be part of love. Vincent looked around the room at all of us. And then he said something that I'll remember for the rest of my life. You know what I learned tonight? I learned that there are two kinds of people in this world. People who believe in miracles, and people who become miracles. What do you mean? Dominic asked. I mean tonight I didn't just receive a miracle. My family became one. They became the miracle that saved my life. Their love, their faith, their absolute refusal to let me go. That was the miracle. He looked at each of his family members with such gratitude and love. And you, Dr. Rosenberg, you became a miracle too. You could have followed the textbooks. You could have stopped trying after 5 minutes, after 10 minutes, but you didn't. You kept fighting for someone you barely knew because a family you'd never met was fighting for him too. I felt something shift inside me. Something I'd lost over years of focusing on science and protocols and measurable outcomes. I felt hope again. Vincent, I said, I need to ask you something. Do you really think your father spoke to you about my personal life? Vincent looked at me with complete sincerity. Doctor, when you're standing at the border between this life and whatever comes next, you see things clearly. You see that every person you meet, every life you touch, is connected to something bigger. He squeezed Isabella's hand tighter. My father told me that tonight wasn't just about my family keeping me alive. It was about showing you that miracles are real. That love is real. That sometimes, the most important healing happens not in operating rooms, but in living rooms, around dinner tables, in the quiet moments when families choose to love each other despite everything. So go home, doctor, Isabella added softly. Go home to your family and choose love. Choose it like we chose to believe Vincent would come back to us. As I prepared to leave the hospital that night, I realized that Vincent DeMarco was right about everything. I drove home, and for the first time in months, I walked into my house before midnight. My wife was reading in bed, surprised to see me. Benjamin, is everything okay? I sat down on the edge of the bed and told her about Vincent DeMarco. I told her about a family that refused to give up on each other. I told her about love that was strong enough to call someone back from death. And then I told her that I was sorry. Sorry for choosing work over family. Sorry for forgetting that the most important healing I could do was healing my own marriage. We talked until sunrise, really talked, for the first time in months. And we chose each other, just like Vincent had said. We chose love. 3 months later, Vincent DeMarco came to my office for a follow-up appointment. His heart was perfect. His tests were better than men half his age. Doctor, he said as he was leaving. Thank you for not giving up on me. Vincent, I replied. Thank you for not giving up on your family. And thank you for teaching me that sometimes the most powerful medicine isn't something you can prescribe. What's that? Faith. Love. The belief that some things are stronger than death. Vincent smiled. Have you seen any more miracles since that night? I thought about my marriage, which was stronger than ever. I thought about how I'd started seeing my patients differently, not just as medical cases, but as people with families who loved them. Every day, I told him. Once you start believing in miracles, you see them everywhere. That night changed everything for me. It changed how I practice medicine. It changed how I see the relationship between science and faith. And most importantly, it changed how I understand the power of love. Because sometimes, love really is stronger than death. Sometimes, a family's faith can reach into an operating room and touch a heart that medical science says should never beat again. Sometimes, miracles happen not because we understand them, but because we believe in them. And sometimes, the most important thing a doctor can do is not just heal bodies, but witness the power of the human spirit to overcome the impossible. I'll never forget Vincent DeMarco and his family. They showed me that in a world full of technology and protocols and medical procedures, the most powerful force is still the simplest one: love. Have you ever witnessed faith make the impossible become real?